So after the surgery is all said and done and the patient has went home, I think it's important to understand what to expect, both in the short term and also in the long term. So for rhinoplasties, generally people will go home, they'll have a little splint on the outside of the nose to stabilize the bones. Looks like a white roof of a house that's kind of sitting on top of the nose. If we do an open rhinoplasty, there'll be just a few stitches right here underneath the nose. And as well, often there's a little silicone splint right inside the nose. So medication starts to wear off, people start to wake up, and there's some degree of discomfort. The first day is a little worse than the day of surgery, and probably the worst day of the whole experience will be the second day after surgery. This is where swelling, bruising, and pain is at the peak. The good news is kind of at the third and fourth day of surgery, things start turning around. Bruising starts going away, swelling starts going away. Around this time, we take the internal splint out, and actually almost 90% of the pain goes away with that one maneuver alone. The splint is doing a lot of great things. It's holding your septum straight, it's decreasing swelling, it's allowing you a little passageway to breathe despite swelling of the inside of the nose, but it's also something up your nose, and clearly it's not comfortable. So when it comes out, it's a great day. People are very happy, and again, we've heard things like that was 80 to 90% of my pain, it's gone. Usually we have a few more days to go, and people continue to do better with decreasing of swelling and bruising. On the 7th day, which is 1 week from the day of surgery, we take the external splint out and the stitches out. And again, a really good day. A lot of pressure is off the nose, and more importantly, people start seeing the result, what all of this was all about. And it's often a good day. People are very happy to see what's going on. You know, sometimes people see televised, the big reveal. There's still swelling, bruising going on. So often on TV that's staged. You know, it's done about a month later and they put the splint back on and they make it all look nice and fancy. But the reality is it's a good day, you see it, but with the caveat that it's only day 7. Recovery from a rhinoplasty is actually a year-long process. And this has to do mainly with how the tissues heal around the nose and how long it takes. And this is not just for me, this is for any rhinoplastic surgeon. Sometimes in secondary rhinoplasty or revision rhinoplasty, it may take even longer because scar tissue is a little more unpredictable. So often I'll tell people that, you know, you're going to have some degree of swelling on your nose. And I try to quantify it. I generally say, you know, at the end of 1 month, you'll get about 30% of your result. At the end of 3 months, you'll get 50 to 60% of your results. And the last part of your results won't come until 1 year. Often people have swelling right around the tip or just above the tip. And invariably, despite saying this over and over again, putting it in writing, at the 3-month visit, people say, Dr. Sinha, I love my nose, except I wish you would have made the tip a little smaller. And often I'll say, do you remember everything I talked about? I said, it is small, but it's small with a little bit of swelling. We do a lot of post-op maneuvers such as taping and massaging the nose. Sometimes we need to do some small injections of hydrocortisone type medication to decrease swelling and scar formation. But overall, I stay with the patient. I always tell them, you know, I'm not just there for the surgery, I'm there for 1 year. You get the doctor for a year. And I just want to make sure I guide the patient to a good result. I'm kind of like the side rails. We want to make sure that you're heading straight toward the journey or toward the goal. And if you start deviating too far one way or the other, it's my job to kind of pull you back. And that's how we're able to make sure through excellent follow-up and good expectations that the patients will have a great and predictable result.